you look at the national budget, the government spends in excess of $1.5 billion annually. And out of that, 15% goes to health. Last year alone, health was allotted a budget in excess of $228 million. When you look at the returns in terms of monies collected throughout the entire health sector, that is Princess Margaret Hospital, all of our clinics, the Rand Hospital, the Sandlands, if we add all of those up in terms of monies collected, we would have collected less than $10 million in spite of spending in excess of $225 million. And therefore, one cannot continue along this line of just expenditure, expenditure, expenditure. Sooner or later, health will bottom out. The problems that we see in some parts of the world. And therefore, we must undergo some form of health financial reform. Sometime one has to make those decisions. Then we must introduce health financial reform. And by reform, what I mean is that one has to enact a formula where once monies are collected and generated for the health sector, a certain percentage of that money must be used for salaries. One cannot go beyond that. A certain percentage of the monies must be used for recurrent expenditures, and a certain percentage of the monies must be used for equipment, and a certain percentage must be used for maintenance. And therefore, once you have a formula like that, that's fixed, and therefore it cannot be changed. So no one can come tomorrow and make a decision and decide that we're going to increase the number of workers overnight, be it for political mileage or whatever. So it cannot be done just before an election or anything, because there's a fixed formula, and therefore your health care is protected. Without that, you can run into problems that we see not necessarily here, but in other parts of the world, where just before elections you find that there's an increase in employment, and therefore there's a decrease in monies allotted for new technologies, for maintenance, and we see what can happen if property or if facilities are not maintained. We all see exactly what happens in terms of deterioration. So we must undergo some form of financial reform, which would definitely protect our health services for the future. There has been a lot of talk about a new hospital. And yes, I would agree that we need a new hospital. And we would have talked about it over and over. We would have done all the groundwork, all the flow studies, the space studies, look at disease patterns, etc. And what we concluded when we looked at the new hospital that we need here in the Bahamas would cost us at least $600 million. That's $600 million that we do not have, and therefore we cannot and we will not get a new hospital. But the existing hospital we must continue to maintain to ensure that individuals still receive quality health care. Now I always say, most of you would know the song by Clarence Carter, the song Patches. And I always refer to Princess Margaret Hospital as nothing more than pants full of patches. But still it's working, and therefore we must continue, if necessary, to put more patches on that to ensure that it works and to ensure that we all receive quality health care. But when we look at the healthcare system, let's look at the problems that we face. We will hear individuals complaining every day about various different things. We deal with service afterward. But one of the problems we hear complaints about is individuals having to wait in the emergency room some length of time. So the waiting time has been a chronic complaint. And therefore, what are we doing, or what have we done to try and correct that? First of all, I want to inform you that going into the emergency room for what you may term a trivial illness may take up to 3-4 hours by the time you're seeing a physician, then having lab tests done, x-rays done, another specialist come down. So you have different components, and that opposed to going into a private doctor's office, you see the physician, he then gives you the request for x-rays, etc., and you leave. Therefore, you would only look at that one-shot deal as opposed to in the institution where you're seeing and getting everything done at one time. That's why the delay. When I myself went into hospital just a few weeks ago, which would have been a trivial phenomenon, I myself who would have been placed in what you call a rapid or fast track, it would have taken me at least 3 hours to get through the system. So what I'm saying is that 3 hours, once you're getting all of the different investigations done, it's not a bad time. But what have we done, and what are we doing to correct that problem? We're seeing a lot of the patient volume in the emergency room is increasing. And the reason is because we're seeing more trauma, we're seeing more motor vehicle accidents, gunshot wounds, stab, etc. And that's placing quite a bit of stress on the emergency room. But in spite of that, we still must deal with those problems and treat them appropriately. What we're introducing a tracking system so that once individuals enter the emergency room, within this tracking system, we would automatically be able to see exactly what time they arrive, and we'd be able to see whom they've been seen by, when they've been seen, or if this particular individual had not been seen, and therefore you'd be able to deal with it appropriately. With time, we'd also use what you call a barcode system, so that as individuals move from one area of the hospital to another, it's just a matter of swiping that barcode and we know exactly where he or she has arrived and how long they've been there. That would give us an opportunity to see which department is somewhat moving slow and therefore correct the problem if they are staying within a particular unit for any native time. So we've done that. Then we recognize that because of all the space problem and the increase in demand, the emergency room becomes somewhat small. And therefore, to deal with that, what we're doing is the general practice section of the emergency room, which is just the eastern wing of the emergency room. We're moving that out into the Collins Avenue area, and that should be completed by the 15th of June, which means that all civil servants and general patients will no longer be seen within the Princess Margaret Hospital. So effective the 1st of July of this year, all civil servants, rather than coming to the Princess Margaret Hospital, can be seen just off Collins Avenue, 4th Terrace at the old Agape Center, for those who know exactly where that is. So that would obviously relieve some of the burden that we see within the emergency room, and therefore we can expand that area. Then there's also a plan, ongoing plan, aggressively, to expand to the Market Street area. You all would know, would have heard of the Old City Market or Market Street. That area, we're aggressively moving to construct a healthcare facility there. And that would obviously relieve some of the problem from the Princess Margaret Hospital. So as individuals are seen within that facility, we would have a paperless record system, so that once you want to transfer that individual from the Market Street Center to the Princess Margaret Hospital, whether they need hospitalization or whatever, it's just a matter of one click of the mouse and their record is already there, as opposed to the problems that we face today, where individuals must travel back and forth with their record and the possibility of that record being misplaced or lost. That won't happen tomorrow, and therefore we're moving aggressively with that being done. Then we would have heard problems about individuals complaining about delay in surgery or not being able to obtain a bed if they had been hospitalized or the doctor wanted to admit them. What problems do we face there? If we were to review the history of the Princess Margaret Hospital, in the 80s and the 90s, the Princess Margaret Hospital was a 450 bed institution. In the 80s, 90s was a 450 bed hospital. In the late 90s, early 20s, that had changed. And the bed volume or bed capacity had decreased. So today we're seeing a hospital which was 450 in the 80s and 90s, which is now 405. So we've lost 45 beds. In the 80s with 450, that bed capacity was filled. So you can imagine the problems that was introduced when you decrease from 450 to 405, and hence we have the problems. You also have more doctors coming back with specialist care, etc. And the amount of theaters that we have present today are the same volume that was there from the 60s, 70s, and 80s. So you can imagine if you added an additional 20, 30 odd specialists, then there's no space for them to operate. And therefore that poses a problem. And that's why individuals will have delays in having surgical procedure. You'll have an increase in physician frustration because they come back with all the specialist care, the specialist knowledge, and yet there's nowhere for them to operate, or there's not the sufficient time that they would have been accustomed to during the training process. And we recognize all this, and therefore one had to look at how one can remedy that problem. And therefore we're expanding not only the emergency room, but we're introducing onto the emergency room what you call a new critical care unit. So this, the Princess Margaret Hospital that you know today, the entrance is here. We're now going to have a new entrance coming from the Shirley Street, area. This would be a new critical care block, which would be 6 additional new operating theater. We'd have new intensive care unit, 21-bed intensive care unit, in addition to 48-bed neonatal intensive care unit. And you'd have a new laboratory on the ground floor. So this would be a 3-story complex. The critical care block, intensive care unit, and laboratory. And the new entrance would have what you call a healing garden in this section, because we all know that individuals within sickness, if you're exposed within a garden environment, that type of thing, you tend to do better. And at the same time, you'll have a new chapel placed there also. So you can hand this around. Of course, the same thing would apply to the Rand Memorial Hospital, where they too would have a new accident emergency, and they too will have expansion of their theater space so that they would move from 1 theater to 2 theater, and therefore they would be able to perform more surgical procedure. Now, why is this important? It's important for several reasons. When you're increasing the number of beds from the present 3 to 6, you can have more surgical procedures done, and therefore the delay that you experience today would not be existing tomorrow. If you were to review the healthcare system in Canada, for example, it's not unusual for individuals to have delay for excess of 2 years. And in fact, Canadians in some cases cannot have their surgical procedures done for less than 2 years. And what they do, they would cross the border and go to the United States and have surgical procedures done. And some may even travel as far as the Bahamas and have their surgical procedures done because they cannot get it done in Canada in less than 2 and sometimes as much as 3 years. But we would not run into that problem. So we'd have a new critical care block with 6 additional new theaters to relieve that problem, which means that our existing ICU would move over. In addition to that, we would have 48 beds for neonates, and therefore the 3 different areas that we presently place the neonates can now be placed in 1 central area, and therefore all of these space can be utilized to expand your bed spaces, and therefore relieve some of the problems that we face today. That's fine, that's fine. In addition to that, with the expansion of this new theater space, the ICU and the laboratory facility, as we ourselves today, as we get older, we tend to face other disease problems. You would hear many individuals complaining of hip and knee pain. Some individuals may not even recognize the problem, why they're not able to walk or immobilize, because they're undergoing some form of hip or knee degeneration. The day to have those procedures done in excess of $50,000, and not many can afford that. And therefore, with this new surgical wing, we would be able to perform hip and knee replacements. We have the surgical facilities, we have the surgeons on board, and therefore we'd be able to do those appropriately. Not only that, but we'd be able to offer quite readily plastic surgery, because again, we have plastic surgeons on board, but again, we don't have adequate space, and therefore this would relieve that problem so that individuals that require plastic surgical procedures would be able to get those done in adequate fashion. And then we have an agreement with Yale University. Yale University has quite a number of its residents rotate through here, and they want to expand that program. Not only that, they want to ensure that the consultants with the residents come down and spend a longer time here as opposed to what they do now. But the consultants would not only spend time here, but those consultants would also be operating. And therefore, individuals that require eye surgery, cataract, etc., would not be operated only by the consultant team here and our residents here, but also by these individuals, the physicians and the residents from the Yale University, because we'd be able to expand that program. Then there's also problems, individuals, we have a high incidence of individuals having bowel problem. You would have heard a lot about cancer of the bowel and other type of stomach ailments. Again, this would be able to accommodate the new gastroenterologists that we would have here, individuals who specialize in bowel surgery or bowel procedures. And therefore, we would not have any delay time or more complaints that we have, like we have today, of individuals complaining that they cannot see a bowel specialist. All these problems would essentially be relieved. So in other words, you'd find that we would be able to have our surgery performed in a more timely fashion. And the delay time that we see today, though it's not long to compare with other nations, especially Canada. In some cases here in the Bahamas, we may have a delay time of 3-4 months, which is really not bad considering other nations. But the other complaint, what we hear a lot about, individuals complaining about medication. There are some who would complain that they've gone to Princess Margaret Hospital or the clinics and they could not receive their medication, or they could not receive their medication in a timely fashion. And that posed some degree of problems. And we were able to introduce the drug plan. And what the drug plan did, we were able to identify certain diseases that we think are very, very problematic to the Bahamas. These what we call chronic non-communicable diseases. These diseases, approximately 60% of our deaths are as a result of these particular illnesses, chronic non-communicable diseases. And therefore it was essential to ensure that the Bahamians had access to these medications in a timely fashion. It was also important to ensure that not only do they have access, but we try our best to try and prevent these illnesses from occurring. And therefore it was essential to introduce a type of health plan, what we call the prescription drug plan, to ensure that these medications can be provided in a timely fashion. The introduction of that plan, I think, was even more essential when one look at the problems that we face today. We have the Princess Margaret Hospital, we have the public health sector clinics. In the clinics, we have approximately 10 clinics within the New Providence area itself. Now you can imagine, with 10 peripheral clinics, that is Fleming Street, Coconut Grove, etc. With all those clinics, we only have 5 pharmacists. So you can imagine there will be problems in dispensing medication if you only have 5 pharmacists, but yet you have 10 clinics. And therefore we've made provisions recognizing that problem. We've made provision to ensure that we have Bahamians who would go off for further training to become pharmacists. And therefore, as of next year, we have an additional 14 pharmacists that would be added to the staff complement within the healthcare sector, and therefore that would help to alleviate quite a bit of the problem. But until that's done, we still would have faced the problem in 5 pharmacists trying to dispense medication. And therefore, what the drug plan has done, the drug plan has enabled individuals to receive their medication within the private sector, as opposed to waiting within the institution itself. And once individuals have the disease entities that are classified in the drug plan and have the disease entities that are classified within the drug plan and meet the criteria, that is 65 years, invalid, individuals less than 18 years old, or individuals 18 to 25, provided they are an institution. These individuals can receive that medication, receive their card through the national insurance, and receive their medication from any of the private participating pharmacies. Effective Monday, the 9th of May, that plan is being expanded. And therefore, it'll be expanded to members of the Royal Bahamas Police Force who would be entitled to receive their card and receive their medication at any of the private pharmacies at no charge to them. It'll also be expanded to members of the Royal Bahamas Defense Force and all civil servants. So civil servants would no longer have to come to PMH. Once they receive their cards, they can again, effective Monday, they can again receive their cards and receive their medication within the private sector. All maternity cases that have those illnesses, again, would be able to receive their medication from the private sector. All patients receiving disablement benefit, retirement grant, those 60 years old who are receiving survivors benefits, again, they too, effective May the 9th, Monday, would be able to receive their medication from the private sector. Other problems we face, we would hear a lot of individuals complaining that they've had problems with the ambulance. Ambulance has not arrived on time, or we don't have sufficient ambulance, etc. We have at least about 15 ambulances, and I think the ambulance are doing an excellent job. But the problems we face, if you were to look at just 2009, 2010, the amount of ambulance calls were in excess of 15,000. And between 2010 2011, the amount of ambulance call was in excess of 16,000. And only 40% of those calls were valid. In other words, 60% were either trivial or just for a ride. So you can imagine the stress that that placed within the ambulance sector. And how are we going to deal with that problem? You would have heard us talk about telemedicine, teleradiology, etc., which I'll explain in a little while. But we're going to introduce within the ambulance sector a technology so that when the ambulance personnel go out to your homes for sickness, or they go to some road traffic accident, or any entity that they're called to, the personnel would have certain type of technology or equipment attached to them so that we would be able to extend the Princess Margaret Hospital to your home or the roadside. In other words, the doctors within the Princess Margaret Hospital would be able to commence their examination of you immediately, either in your home, if that's where the ambulance came, or they would be able to commence that examination at the roadside. It means that what we're doing is extending the arm of Princess Margaret Hospital and making your home on the roadside a part of Princess Margaret Hospital. And therefore, having done the assessment, the doctors would be able to make a determination that no, this patient don't need to be transported, that patient only needs to be given so and so, and they can go to the clinic and see their doctor, or if they want to go and see a private doctor, they can go and see the private doctor either next week or whatever. But we would be able, through technology, to now examine you just as if you were in the Princess Margaret Hospital. We would be able to come to your home or at the motor vehicle accident site and start your examination there. That would do several things. One, it would cut back on the amount of unnecessary passenger or unnecessary free ride to the institution. Our ambulance would be able to go out on proper calls, and at the same time, what we would also be able to do, we'd be able to improve the outcome or the quality of care, because that 10-15 minutes of medical care within your home or within the accident site could make a big difference in terms of your life or the outcome or the morbidity. And therefore, we definitely would improve there. But I'm talking a lot about New Providence. Those in the family islands would be asking the same question. Should they be deprived of health care, or should they not receive the same quality health care as us in New Providence? And the answer is yes. The problem they face today is once they are seen by their doctor, or in some cases the nurses, decisions are made where those individuals must be transported here to New Providence by air ambulance, or in some instances they may be referred to a specialist here, and because of not having a paperless trail, the records may be displaced, the individuals themselves could be lost in the system. They find themselves, the clinic is canceled, etc. And they can tell you every day about the frustrations that they face. And we recognize that. So we've started building what we call the health bridge to the future. We want to extend the arms of the specialist care here in New Providence to those individuals in the family islands also. Because those individuals in the family island, if a specialist here is seeing the patients in New Providence, those individuals in the family islands deserve to see that same specialist without having to travel back and forth New Providence with extra costs for airline, transportation, accommodation, etc. And therefore, we have introduced what we call telemedicine. What that technology allows us to do, an individual, that system was first introduced in Abaco. What it means is that once an individual had been seen in Abaco by their doctor, and that doctor feel that that individual should be seen by a specialist, let's say a Dr. McNeil, pediatric specialist, or some other specialist, then what happened is, rather than that individual in Abaco traveling to New Providence to see a specialist, that specialist, through our technology, would be able to remain in the clinic within Nassau and examine that individual in Abaco, just as if they are in front of them, just as if they are there in New Providence. So the individual do not have to travel to New Providence anymore. We have introduced that, and we've been successful with that system. In January of this year, we've commenced what we call a skin clinic, a dermatology specialist skin clinic, between ourselves, New Providence, and Abaco. The skin clinic here in New Providence may be at our clinic 9 o'clock in the morning, and the specialist would see the patients here in New Providence be at 9 to 12 in the morning. And then at 2 o'clock in that same clinic, the specialist would commence the Abaco clinic, meaning that the patients in Abaco would only go to the examination room in Abaco, and they would be seen and examined by the specialist here in New Providence without having to travel back and forth. We've been successful in doing that. And in January, that program was commenced, and in the first month of the program, the skin specialist, Dr. Orlando, was able to see 42 patients from Abaco who did not have to travel here to New Providence. Not only was he able to see, examine, and give these patients their medication, but of those 42 patients, he was able to determine that 3 patients, the skin illness looked somewhat cancerous. And therefore, those 3 individuals had the skin biopsy or piece taken. And 1 came back as cancer. Now imagine if we did not have that system, what would have happened is that cancer would not have been diagnosed. That individual would have gone on for a time, carrying that cancer and subsequently could have died eventually, because the cancer that we're talking about is the same cancer that most of you would know, what we call melanoma, that had killed Bob Marley. Bob Marley would have died from the same type cancer. So just using this technology, with our doctor being here in New Providence, he was able to biopsy the patient in Abaco and diagnose that case. So that continues. Now what it also means is that we can expand not just from skin, but to other illnesses also. And you can have second opinions if necessary. So just as we have our pediatric clinic here, what we're moving to, we can have the pediatric clinic here by the specialist on Mondays at 9 o'clock. Then at 2 o'clock, you can start the pediatric clinic in Abaco. Tuesday at 9 o'clock, you can have the pediatric clinic in Eleuthera, but with him being here in Nassau. Then at 2 o'clock, the pediatric clinic with Long Island could commence, again, without having to travel back and forth. So you can imagine how effective this is, the cost saving, and individuals don't have to bring the babies or adults back and forth, don't have to worry about accommodation, etc. So that's what we're moving to. Effective May, the end of May of this year, we intend to launch the project in Andros, and therefore those patients in Andros, once they're seen by the doctor there, and the doctor feels that they need a specialist opinion, those patients would no longer have to come to Nassau. They can be seen by our specialist here, assess, make a determination without having to travel back and forth. And the technology is so advanced that it's as if the doctor is in the room in Andros examining that patient. There's no difference. So you who in Nassau seeing the physician, there'll be no difference in care, no difference in examination with the individual who's in Andros. Then the end of July, we would launch the program in Long Island, the same thing. So what you see we're doing, we're building a health bridge to the future where the Bahamas, though we're separated by water, would no longer be separated by water. In terms of health, everybody have access to health care, and it's not a matter of transportation anymore. You are being assessed by the same specialist here. Because we know that we'd never be able to have sufficient specialists to go to each and every island. But if we can introduce technology, then we can have one specialist, two specialists who can see patients in each and every island without having to go to each and every island. Instead, the islands are just interconnected to our institution here, Princess Margaret Hospital, and be dealt with appropriately. And we've been successful with that. The other problem we face, that's the medical aspect. The other problem we face would be radiology. It is true that we would have X-ray facilities within the family islands that may have been there in some instances for excess of 8 years, in some cases up to 10 years. And these facilities has never been used. They're still in the box. The problem is, we would never be able to have sufficient radiologists. Never. Not in my lifetime, not in yours, not in your grandchildren, not your great-grand. You'll never have sufficient radiologists for each and every island of the Bahamas. The US, first world countries, all face the same problem. The problem is a lot of the x-rays that we purchased yesteryear were what we call analog, and therefore they would need actual technicians and radiologists there to perform it. What we're doing is converting those analogs to what you call digital, so that now we would only need a tech, so that that x-ray that's performed in Andros or wherever can be read by the x-ray, by the radiologist in New Providence or wherever, without having to travel back and forth. That can be done, and we have sufficient staff to deal with that. We now have an ongoing pilot program between Grand Bahama, the Rand Memorial Hospital, 8 Mile Rock Clinic, South Beach Clinic, and Princess Margaret Hospital. And therefore, x-rays that are performed in any of those institutions can automatically be read within a matter of seconds by a physician in any of those 4 institutions. So an x-ray that is performed in the South Beach Clinic, for example, if our radiologist is not here in New Providence, the radiologist in Grand Bahama at the Rand Memorial Hospital within a matter of seconds can see that x-ray, read it, and report on it. The same thing happens at the Rand Memorial Hospital. So a radiologist in any of those 4 areas can automatically read it. So you can imagine if we were to expand that to the other family islands, then what happens is not only would all the family islands have access to specialist medical care, but they now have access to radiology also. And therefore it's only a matter of the tech taking the x-ray and the radiologist, be he in Grand Bahama or New Providence, can read the x-ray. And it's our intention that we feel that Nassau is probably overwhelmed or swamped with volume in terms of x-rays, etc. And it's our intention that the family islands should probably be read by Grand Bahama. What that would do, patients tend to follow the x-rays or the investigation. So what that would do is help to boost the Grand Bahamian economy. Because if an individual knows that the x-ray is being read by Dr. So-and-so in Grand Memorial Hospital, the tendency is that they would probably go there for further care. And remember, we're upgrading their healthcare system also, and therefore we'd be able to alleviate that problem. Presently, the pilot program is working very well, and we're having excellent results, and we can interpret and read the x-rays between all the 4 different entities. And with time, you'll be able to expand that not only to x-rays, but to mammograms and ultrasounds also, which means that no longer will individuals have to travel back and forth for mammogram, but they can stay within their hometown and have it read by the radiologist here in New Providence or Grand Bahama. And the same thing would apply to ultrasound. That's extremely important, especially individuals at the family island. If they were pregnant, they can be assessed. They can be in the family island and be assessed by a specialist here in New Providence, or Dr. George Sherman or whoever. They can assess them without them having to travel back and forth. So that's where we're going. But today, we have been successful with the x-ray technology, and we would move with the ultrasound and the mammogram technology. We're also moving to make the entire Bahamas interconnected with what we call paperless record. One of the big problems you face, if you were to attend one of the clinics and you are being referred to the Princess Margaret Hospital to see a specialist, or they want to admit you or whatever, you must, first of all, they must try and make a call, which sometimes becomes cumbersome. And not only that, they sometimes send you the record, and you may be diverted, or your records could be lost, and then you have to start all over again. So you have to do all the investigations all over again, which means that's costly again, cost to you and I. But if we had the paperless system, where once an individual saw you, let's say at South Beach Clinic, and they wanted you to be seen at Princess Margaret Hospital or whatever, it's just a matter of click of one mouse, and their records are automatically here, so that they can be reviewed, and no repeat investigations performed. The Market Street Clinic that I'm talking about, that we're aggressively pursuing, that obviously would have all of that intact. We're also moving aggressively with community hospital in Abaco, the community hospital in Exuma. And work is going very good, very productive, and we should have groundbreaking for those clinics sometime this year. Those community hospitals will have all of the technology and infrastructure of which I spoke about, and therefore they will be seen and reviewed by specialists here in New Providence also. those community hospitals will also have access to paperless record, so that once they are seen in Abaco, if they must be referred to New Providence to see, example, the plastic surgeon, then that record is automatically, just by a click of a mouse, that record is automatically transferred, so that when they arrive, the plastic surgeon will have already seen their record, reviewed it, and know exactly what to do. The question is, everybody say health is spending, spending, spending. The question everybody asks, how is this going to help in growing the economy? How is this going to help in terms of creating employment, job opportunities, etc.? And there are great opportunities. Now, think about it. If we have already been successful in launching our medical program between Abaco and New Providence, where we have regular specialist consultation between those islands, we have regular clinics, skin clinics between those islands. We have been successful in running our pilot program with x-rays between Grand Bahama and New Providence, South Beach Clinic, 8 Mile Rock Clinic, ran and New Providence. Then what's to stop us? What's to stop us from expanding that technology to Cayman Island, Turks Island, or the other Caribbean territories that does not have specialist care? Why should they have to, just like we do today, get on a plane and travel to Florida or some other entity destination? What I'm saying is, we have an opportunity to expand outside the Bahamas. But one of the mistakes we continuously make is believing that the Bahamas is the world. And once we concentrate only on the Bahamas, our employment opportunities would become limited. If we extend outside the Bahamas, then it means that the world is at our feet and employment opportunities expand. And therefore this technology allows us, it allows us to grow our economy. It allows us for individuals who become involved to increase their financial status. It allows opportunities for individuals, young people, in terms of technology. Because remember, if you have a system at the various different entities, you must have individuals who are computer savvy and knows how to work the system. And therefore there are job opportunities there also. But what is most important, it allows you to expand, to make the Bahamas the health brain center of the Caribbean. Meaning that because we have the specialists, because we have all the different entities here, then those individuals throughout the Caribbean, they can be consulted by our specialists here in New Providence without having to travel abroad. Those centers in the Caribbean, Turks Island, Inagua, wherever, rather than, if an x-ray is performed, rather than trying to accommodate a radiologist who may only visit once or twice per week, they would have access to a radiologist every minute of the day. What our technology also allows us to do, today you would think of a radiologist having to go into the x-ray room to read it. But no, when I talk about Grand Bahama and New Providence, with the x-ray facilities, what the technology allows, the radiologist can stay within his house, be in the bedroom, be in the dining room, the kitchen, etc. The radiologist can stay there, and he or she can read the x-rays right there. And therefore you don't have to be traveling back and forth. So I think this is great opportunity for expanding the economic sector of the Bahamas. But I won't at this time get into all the job opportunities that will be available. But you can see how not only would you have economic growth, but you'd also have job opportunities that will be created where we're heading. So I don't want to speak much longer at this time. What I'll do is just open the floor for questions and would entertain all of your questions that you have, answer as many as I can.